Democrats criticizing the Republicans' health care bill. Obamacare is in the final stages of collapse. People are now losing their insurance under Obamacare. Health insurer company Aetna announced it is completely pulling out of the Obamacare exchanges by 2018, stranding people nationwide. People are losing their doctors, too. Doctors are pulling out as well. Now, Aetna was upgraded by Cleveland Research from neutral to buy today after that news. The stock is moving higher, closing up for the day. Joining me now, Fox News medical aid team, Dr. Marc Siegel. He's here. Are people going to die from Republican reform?
Absolutely not. That's myth number one. Pre-existing conditions continue to be covered under the Republican health bill. In fact, that part of it is the same, which is that you're going to end up having to see it reflected in your premiums. So the biggest worry is that premiums are going to stay high, but pre-existing conditions remain covered. Only in a state which asks for a waiver, Liz, for people who let their insurance lapse. I don't know why they would do that, but if their insurance lapses, then they could be put in a high-risk pool. But the government
then they would have to pay for more insurance. But the $138 billion is what the Republicans are talking about, the pool for pre-existing conditions. And states, according to Karl Rove, states cannot get a waiver to not cover pre-existing conditions,
Absolutely.
Right?
He's 100% right. And you would cover it with a high-risk pool if you got the waiver, but then you're going to prop that up with more subsidy.
So this is really...
This is a myth.
This is real, and it's journalism malpractice by MSNBC and CNN when they don't have the journalists asking the questions and reading the bill. I mean, the Democrats are attacking the bill without even reading it, and so are the journalists. I've tried to read through what they're doing, and I'm trying to stay on top of that, but you've got news about Aetna and how much Aetna has pulled out of the Obamacare exchanges.
Well, so that's a point that really echoes the point President Trump has been making, which is that Obamacare is going belly up anyway already. I mean, United Healthcare went from 34 states exchanges they were involved in down to 3. Okay, that pre-exists Trump's presidency. Aetna went from 15 down to 2. Delaware and Nebraska, now 0. So the news isn't the way it's being sold by the Democrats or some of those other media outlets you say that, you know, somehow instability in the markets because they don't know what the government is doing is pushing Aetna out. Excuse me, Aetna went from 15 states to 2 before President Trump was elected.
But, you know, Jonathan Gruber, you know, we're all too stupid to understand health reform, the co-architect of health reform of Obamacare, he said it's Trump's fault.
No, it pre-exists Trump, but let me tell you whose fault it is.
The insurers started pulling out in 2014.
Absolutely, and let me tell you why, Liz. Let me tell you why. Here's the fault. It's because Aetna analyzed it in 2016 and found out that 55% of the people that had signed up were new that year on the exchanges, and guess what? They were sick and they had high-risk conditions. You know why? Because young people, 45% of the people who took the tax penalty were under the age of 35, meaning the whole idea behind Obamacare, the SAPs were going to be the 27-year-olds who paid for the older people. They didn't sign up.
I hear what
so
you're
Aetna
saying.
said, look, you only allowed us a profit margin of 20%, but you only gave us sick people.
I get it. The issue is that Obamacare built these mini monopolies for each state, and the insurers could ratchet up the cost because they were really sick people. The Republicans are trying to get rid of all that. So the question is, will the Republicans cut Medicaid? Are they going to hurt people that way?
Well, okay, so here's 2 things I want to say about the bill. Number 1, my prediction in the Senate is that the Medicaid expansion will stay. I do not believe that the cuts to Medicaid will stay in. I think the Senate is more moderate, and I also think there's 20 Republican senators in those 32 states that are up for re-election. They're popular in 32 states. I say the Medicaid expansion will stay in. That's one thing. The other thing I want to point out is the biggest thing that the bill does on the positive side, Liz, is it gets rid of mandates that force you to buy something that doesn't give you what's advertised.
Like what?
You come to Dr. Siegel's office and Siegel says, okay, I take Obamacare, sir, but guess what? My orthopedist doesn't, the OBGYN I use doesn't, I can't get you to the radiology suite I want, you know, the cancer center, God forbid, doesn't take it. Narrow networks of doctors, high deductibles so you can't get the care you need. So it's really indecent and unethical to say that something should be mandated that doesn't give you the care that it's promised. And getting rid of that is a huge step in the right direction. It's really
astonishing, the coverage that's going on, and it's misinforming the American people. Dr. Siegel, come back soon. I'm so glad you basically exposed these myths and gave the truth.
One more thing, Liz, by the way, the government has safety nets. You know, there's this idea that people are going to be out on the streets. The government has a National Health Service Corps, and they have 22 million people are covered under federally subsidized clinics in the United States. That's the safety net.